We are bringing together a panel of experts to answer your questions about the coronavirus and the massive economic stimulus package. CBS News medical contributors, that's Dr. David Eggis, there they are, Dr. Tara Narula are with us, and Jill Schlesinger's here too. She's our CBS News business analyst to answer all your questions. David, we're going to start with you first. It comes from Laura from California. You've got a twofer. She asked, can you get tested to see if you may have it already? And then someone named Gail at the Stephen Colbert set wants to know, if you already have the virus and you've been diagnosed, how do you know when it's safe to re-enter society? Start with Laura first, please.
All right, so that's our dream, is to have a test in the blood to see who had the virus and who made an immune response. Other countries have it. It's out in China. It's out in some of Europe. Hopefully we will have it in the next week or so. And that's critical to know if you can go back, because what we think is that if you have immune proteins, if you have antibodies in the blood, which this test will show, is that you cannot get the virus again, at least for a short term. We don't know long term, because the virus has only been around since December.
And how do you know if you have it when you can re-enter society, if you've been diagnosed?
I forgot that someone named Gail asked the question. Yes. It is 3 days after symptoms are totally gone and 7 days at least since the beginning of symptoms. So if you meet those two criteria, you can go out.
All right.
All right. And we've got a question now from a viewer named Dave. This is for our Tara Narula. And the question is there any proof that the coronavirus can be caught by pets? Can it go to our pets?
A lot of people want to know about pets, and so there's no evidence to date to suggest that pets can either be a source of infection or that they can contract COVID-19. That being said, there really is a lack of data and research in this area. So the CDC says if you are suspected to have COVID-19 or you've tested positive, you really do want to maintain distance from your pet the same way that you would from humans. So you want to avoid the kissing, snuggling, petting that you love to do. And if there's someone else in your home that can help take care of your pet, you want to ask them to help out. If it must be you that does it, make sure you wash your hands before and after you interact with your pet.
I've got a question for Jill, which comes from a viewer named Elaine, who wants to know, does the $1,200 relief check that's being sent to individuals include retired seniors, Jill?
Absolutely, it does. So even if the only source of income is Social Security, you will get this check as long as you fall below that $75,000 threshold. And even if you don't file taxes, don't worry. The government will access your information through the Social Security system. So seniors, you too will be getting checks.
Jill, I've got another one for you, too. It comes from Debbie. She says she's been out of work for 2 weeks. She wants to know, when will people see their unemployment money?
Yeah, I'm hearing from a lot of people around the states. Usually states have a 1 week waiting period. They're encouraged to waive that. But because of these flood of claims, we saw over 3 million in a week, that is stopping up the system. Debbie, I'm hopeful that you get this in the coming week. So 2 to 3 weeks is what we're hearing from the crowded states where there are tons of claims.
All right, David, you know, the weather is getting warmer every day, and one viewer here on Instagram asked, are we learning anything from studies that look at the weather and virus effects?
Not yet. It's just too new. The virus began in December. I mean, the hope is that other viruses can go away as temperature goes up. So we don't know with this one, but we do know our behavior changes. And as temperature goes up, you're out of doors. The UV sunlight degrades the virus. The virus is not alive. And so will temperature itself get rid of these particles? We don't know. I hope.
All right, this is for Tara. It comes from a viewer named Julie, who's 64 years old, has asthma, wants to know about non-essential doctor visits. She asked specifically, is it safe to go to a chiropractor? Tara?
Well, so Julie's over 60 and she has asthma, both of which are going to put her at increased risk. So you want to look at who you are, what your vulnerabilities are, but also what is the service or the visit for. Certainly if it's something that's urgent, you know, your doctor or the health professional may want to see you. If it is non-urgent, most doctors' offices are rescheduling and pushing patient visits out at least 45 days or so. This is a great point where telehealth or telemedicine can be useful. Lots of doctors' offices are doing it for more non-urgent issues.
Jill, another one for you. This is Denise on Facebook, who says, so workers who are laid off due to the coronavirus, will they get their full payment will they get their full pay through the unemployment department?
No, they probably will not. So there are going to be two tiers of unemployment. One is through your state of residence, and that goes as much as 26 weeks. And that usually covers somewhere between 40 to 50%. Again, very state specific. And then the government program that will tack on 13 weeks to whatever the maximum is in your state, and will also provide you with $600 a week for 4 months through July. So you've got to check with your state. Probably you'll end up at maybe 70 or 80% of your pay prior to the virus.
Hey, Jill, while we have you, there's a viewer named Doug who's got a question that I share as well. If you get this $1,200 stimulus check, do you have to pay taxes on that?
No, you do not. And that's great news, right? Because that would be sort of a little weird double whammy. There's one little issue, though, because you're basing your check on your adjusted gross income, line 8B on your tax return. If you have not filed yet for 2019, they're going to go look at your 2018 returns. The only adjustment that could be made is if your income really changes, maybe goes higher in 2019. I don't think that's going to be a problem for most of the people who are involved here.
Anthony?
Oh, sorry. I thought you guys were picking that up. This is for David, and it comes from Diane on Facebook, who asks, since this is an illness that attacks the lungs, if you had the pneumonia vaccine, does that provide some protection against the severe symptoms?
Great question, and the answer is no. The pneumonia vaccine is against a particular bacteria that can cause pneumonia. This virus is totally separate. While they both cause pneumonia, the vaccine will not affect your response to the virus at all, and you're still as likely to get pneumonia, unfortunately.
And Tara, this comes from Vanessa on US on Facebook. She wants to know, I keep seeing posts about people making masks for the medical professionals. Is this actually okay and approved?
Well, so the surgical masks and the N95s are the ones that are really certified and regulated. And that's because they're tested for how they fit with the materials that are used, how permeable they are, what kind of a barrier they are. That being said, in a crisis situation, which we are in, and we're hearing so much from the frontline workers about how they lack personal protective equipment, any sort of a barrier, even if it's a cloth mask, may help prevent those large droplets from entering the nose or the mouth of the healthcare workers. So there are some hospitals in this country that are accepting donations, others are not. So you need to check in the local area where you live. But certainly it is inspiring to see how many people have stepped up to try to help.
Tara, I've got a question. Well, we can stick with you here, and it's one that's come up in my household. We're all washing our hands constantly. It's wintertime. We're dry. Our skin's dry. And we get these kind of cracks. And not only are they painful, but my question is, when you have cracks on your hand, does that make you, are you more susceptible to touching something and have the virus get inside you?
Well, it's not really that the virus would get in through the skin. So that's not really a portal of entry. But we know that your hands, if they touch droplets and then you touch your face, you can certainly spread it that way to the nose or the mouth or the eyes. So you definitely want to be careful about where you're putting your hands and where you're touching, which is why we say hands below the neck if possible. I know it's difficult, but really try.
David, I want to follow up on the stay home, stay safe, because a lot of people, more and more people are self-quarantining. Is it okay to go outside to just walk around the park? Is that safe? Because somebody told me no, you shouldn't even go outside because you can pick it up in the air. You can pick it up on your feet when you're walking around. What is the truth about that?
Yeah, it's okay to go outside. UV sunlight does degrade the virus. You need to maintain social distance. There's talk in New York of closing streets so that people will make it easier so they can actually walk in the street and have that social distance. But we're going to go stir crazy if we're sitting in a room staring at four walls.
Can you pick it up on your shoes?
So the key is to do it safely.
Somebody said you can pick it up on your shoes walking in the street. Is that true?
I can't imagine that the virus is going to live and then be able to carry through in your shoes. That being said, you can always leave your shoes at the door if you're worried.
I know. Honestly, everybody's so on edge. The slightest little thing just sort of sets you off. That's why it's good to know the facts and nothing but the facts.
Yeah, indeed. A lot of good information there from the three of you, David, Tara, and Jill. Thank you very much.